Hello, everyone. It's an honor to present here with a room full of experts on the topic, so I'm a bit nervous and already apologize. All right, so me and Dominique, we are going to talk about the study that we conducted on HPV vaccination program. Today, we are only reporting on introduction challenges, and I'm going to report an overview from national stakeholders. Sorry. So talking about the objectives of our study, so we wanted to identify specific organizations, stakeholders, and resources in the HPV vaccination landscape globally, regionally, and at the country level. We also wanted to describe stakeholders' role, relationship, and level of influence and position on HPV vaccination issues, and also under defined context, priority issues, key challenges, and opportunities. So this is a map for our stakeholders that we interviewed, and I'm going to focus on the national stakeholders. As part of the national stakeholders, we wanted to identify countries and be very cognizant of the choice that we will make. So we made it a short list of countries based on the level, the status of introduction and the level of coverage, the program diversity, and also geographical inclusion. In total, I reached out to, just have to turn to see better, 30 national stakeholders and 34 stakeholders from NGOs. And out of those, we were able to have interview with 18 stakeholders. Our stakeholder mapping was based on the literature search from various databases, as well as websites of different partners in the field, and the network of the project, as well as the snowball approach. So our study covered various themes: the start decision-making, prioritization, introduction challenges, HPV vaccine delivery, impact of COVID-19, and scale-up. But today we are only going to focus on the introduction-related challenges. To jump right into it, so some of the challenges that I've summarized for today's presentation is health information system, HPV vaccine delivery, communication, stakeholder mobilization, training, and competing priorities. A lot has been said during the day, so it will be more of a summary to just confirm some of the challenges that were discussed by esteemed speakers. So going back to the health information related challenges, the summary of findings of our study was almost all stakeholders voiced the lack of local data availability for decision-making, for planning, lack or absence of cancer registries, reliable data reporting, collection, and storage mechanism. It also affected data retrieval at the time when they had to report the coverage data. But not just that, they also highlighted that there's not enough human resource and technical capacity to level up the data reporting or strengthen health information system. In terms of the stakeholder coordination, one of the finding of the study was that it started from the time of decision-making process when certain stakeholders were not involved in the decision-making process. That also created conflict on the program placement and competition on resource mobilization, where each stakeholder were competing to take ownership of the program. And that reflected in the decision-making and eventually the planning process. Some of the key challenges, and I will not go into too much detail because we have a whole session on delivery strategies coming up later during the day. But we asked the stakeholders about the delivery strategies that they have in place in the country. What are the challenges with each of the delivery mode that they have? And I have summarized briefly the challenges about campaign mode and routine mode. And some of the challenges that came forward for the campaign mode were lack of preparedness assessment, the challenging logistic, the fact that a lot has to be done in a specific period of time, as well as the operational cost and the initial resource limitation while introducing the vaccine. But at the same time, they also voice strong interest in having the campaign approach because it allows them to achieve target and have very defined goals that they can achieve in a few weeks or in a few months. whereas heading to routine mode, whereas some countries are using it and is available all year round, they did have challenges with COVID-19. It was hard to bring parents to the health facility, or even in general, to even mobilize parents to come to the health facilities to vaccinate their girls. In terms of the micro planning, so this was also highlighted as one of the major challenges to maintain coordination between Ministry of Education and Ministry of Health to identify if there is any existing, if not a national adolescent health program, but even a school health program, if that is available or they could be integrated, but that was usually not fully done. And also the struggle to arrange vaccination sessions with the calendar of the school and during the holidays, and some to summarize few challenges. In terms of overall challenges with the remoteness and reaching out of school girls was also reported as a challenge across programs. So we also asked stakeholders how healthcare workers are trained, and something that was repeatedly strongly voiced was lack of training among healthcare professionals, and how that's not was initially anticipated to be that important while they were planning to introduce or while introduction of HPV vaccine. And it was not taken into consideration that there's staff turnover, which really highlights the importance of training, refresher trainings or periodic training. We also looked into different training approaches, and it was cascade and the other training approach, and how dilution of training is a challenge as well when it comes down from the national to the district level. There was about the content of training, there was lack of clarity on the age eligibility among healthcare professional, disease etiology, and why a specific type of vaccine is offered. When we are living in an era where information is available now to people and they're aware that there are different types of vaccine, and it becomes some questions are raised why a certain type is available in a country and another one is not. Another key factor that was highlighted was that there should be sufficient time for training as well in the planning process. And one of the challenges was that often it was put in the planning process, but for some reason or the other, it was rushed and not completely achieved, and not all the processes were ticked off. And also the inability of healthcare workers to tackle misinformation. Stakeholder coordination, and I think this is what this panel discussion is also about, that I mentioned. Sorry. Go back. So in terms of stakeholder coordination, it's a bit mixed up. I'll just move on to communication because there are some changes that were not updated on the slides. So for the communication was also a challenge, and almost all programs reported that while introducing the rumor that why only girls, and this is a campaign for causing infertility among the girls, was voiced strongly among the stakeholders, as well as lack of sufficient communication material, lack of clear instruction for the district level staff, and often in a post-introduction evaluation conducted in one country, they found out that sometimes the material was sent without any instruction to the district level staff, and it was not used very efficiently. To summarize some of the points that I've raised, it's crucial that there are efforts to improve data collection. Timely planning is something that needs to be taken into consideration, as well as improving partnership and training healthcare workers. And I'll now hand it over to my co-presenter.
Good afternoon, everyone. It is such a pleasure to have the opportunity to present our research that Nayab and I collaborated on. So Nayab spoke to the national stakeholder perspective. I'm going to speak on the global stakeholder perspective in terms of factors that influence HPV vaccine introduction and some of the challenges that are faced. So starting off with specific objectives, I'm not going to go deep into this because Nayab already provided a great summary, but essentially we aim to elicit stakeholder perspectives regarding challenges and facilitators in addition to opportunities that face HPV vaccine introduction and scale up in low and middle income countries. So I'm going to speak to our stakeholder mapping process from a global perspective. So essentially, we categorize global stakeholders into two categories. We had academic partners, we had global immunization partners. We identified these partners through a comprehensive literature search. So we looked at peer-reviewed databases, as Nayab previously mentioned. We also did a gray literature search. We did not want to leave out articles or reports that may have not been peer reviewed, but yet were still relevant to this space. So after conducting the literature search, we identified stakeholders that were relevant from a global perspective who were conducting relevant work in HPV vaccine introduction. We also identified stakeholders through institutional knowledge and key insight. So for academic partners, we identified 45 individuals in total. For global immunization partners, we identified 16 organizations in total. And so the table that I have here kind of breaks that down. For academic stakeholders, we had individuals based in Kenya, South Africa, the UK, Zambia, and Nigeria. And just to provide some information for the UK, even though this individual was based in a high income country, they had a sustained program of research in LMICs. And so that's why we included them. And then as you can see for the global immunization partners, we had various entities that were included in our stakeholder analysis. So these are the key challenges that we noted after our data analysis, the challenges that face HPV vaccine introduction and scale up. So starting off with financing, followed by prioritization, vaccine accessibility, equity, and ethics, global supply challenges, capacity and delivery considerations, and lastly, communications, social mobilization, and advocacy. Starting off with more so upstream determinants. So with financing, all stakeholders that were interviewed really noted the high cost of HPV vaccines. As we know, this is the most expensive vaccine on the market. Not only is the vaccine price a challenge, but the extensive resources needed to deliver the vaccine was another financial challenge. Many individuals really elicited concern in regards to Gavi eligible countries, even though they may have Gavi support, they still have difficulties maintaining Gavi co-payments. So this leads to concern for sustainability over the long term, especially as countries begin to transition out of Gavi support. There was also a lot of discussion about the need to develop financing mechanisms for middle income countries that are ineligible for Gavi support. There was a lot of comparison between HPV vaccines and routine childhood vaccines and the immense resources really needed for HPV vaccines. In regards to vaccine prioritization, this was a key factor to introduction and scale up, as many of us know. This was strongly underpinned by political will and commitment. And political will, commitment, and buy-in was strongly influenced by accessibility and availability of data and local evidence, data pertaining to vaccine and disease impact. And with vaccine and disease impact, this was not just from a public health perspective, but this was from a social and economics perspective as well. In addition, COVID-19 was found to be a key detractor to prioritizing HPV vaccines. And I have a quote here that really describes some of the comparisons between HPV vaccines and routine childhood vaccines. So the next theme that was elicited that was found to be a key challenge was capacity and delivery. So as many of us know in LMICs, countries tend to have very fragile or weak health systems. However, immunization and vaccine programs tend to be relatively strong. So there was this constant discussion about the need to leverage the strength of vaccine and immunization programs. Unfortunately, in many instances, there were inadequate human resources, so this was a key challenge for many countries. There was a consideration about the most effective delivery platforms, comparing targeted delivery and intermittent delivery to continuous delivery, so comparing school-based to health facility-based delivery. Although school-based delivery was found to be more effective, it was more costly. So an example was given in Zambia, for instance, in which They introduced the HPV vaccine within schools, but because of the tremendous costs that were involved, they transitioned to health facilities. So this was a key consideration amongst many stakeholders. One stakeholder who was based in a middle income country really noted the need to consider, once again, financing mechanisms, perhaps looking at insurance coverage within middle income countries. And lastly, service integration. So how can HPV vaccines be effectively integrated with cervical cancer screening services, HIV treatment services, and other routine adolescent health services? In certain instances, global vaccine supply was found to be more significant than financing. Several global immunization partners really described this. The inadequate global supply to meet the global demand was a key challenge. And many individuals noted the need to consider local vaccine accessibility or feasibility of local vaccine production within LMICs. And also several stakeholders, particularly global immunization partners, really described how new manufacturers coming on the market can help to overcome some of these challenges. The next theme that I want to discuss is vaccine accessibility, equity, and ethics. Socioeconomics was pivotal in terms of accessibility, so socioeconomics from a community standpoint. There was also discussion about the need to consider gender neutral programs. As many of us know, there's been a few individuals today in their presentations really mentioning the need to not only focus on adolescent girls, but also adolescent boys as well. And then this was also found to be underpinned by geographic challenges. So how can rural areas in particular be effectively targeted for HPV vaccine introduction and scale up? Communications was a very critical theme. Every stakeholder that I interviewed really described communications challenges, the need to build confidence and generate demand for HPV immunization programs. Unfortunately, in many instances, when there are budget cuts, communications tends to be the first thing to get cut. And this is really unfortunate because, as we know, there needs to be sustained communications efforts to heighten scale up and to heighten acceptability of HPV vaccines.
Hey, Dominique, sorry, Dominique, you got 2 minutes.
Oh, okay, I'll speed through. Message framing was another concern in addition to training healthcare providers as well. Social mobilization and advocacy was also pivotal. The need to really elicit advocacy from professional groups, first ladies and community leaders, and multiple examples are provided of this. The need to empower youth was also pivotal. And finally, local solutions, generating local solutions to local problems. Vaccine acceptability was another theme that was discussed. There was discussion about how can you call a community hesitant when there's limited knowledge and awareness. So is it really hesitancy or is it just lack of knowledge and awareness? And how can we effectively capture this? And vaccine acceptability was also found to be influenced by misinformation and stigma. And I have a quote here on the right that demonstrates the need to empower youth. So finally, in conclusion, once again, there's a need to develop local solutions to local problems, making sure that all relevant stakeholders are sitting at the table, healthcare providers, community health workers, teachers, academicians, all of these individuals need to be sitting at the table involved in decision-making to ensure that programs are locally driven. And in addition, local evidence needs to be available to drive decisions and to drive scale up. Finally, or capacity strengthening and support is another factor that needs to be considered as well. And then finally, increase support for communications programs, as this was found to be key in generating advocacy and buy-in from an upstream level and a downstream level as well. Thank you.